It is a very welcome combination of an incredible scientific brain, and a very politically active individual, which is what we need. We need more scientists in politics. Jana is a brilliant example of that, doing incredible work in Czechia. Jana, please come and enlighten us. She's awesome.
Okay, Steve notoriously overselling. Here are your glasses. I don't need them, thank you. Okay, so I will start my own timer here because I'm afraid that it will be too long. But I don't know if you know about Czechia. We are a very small country in the center of Europe. But regarding the decriminalization and drug policy, I think we can give some kind of hope to the rest of Europe, not only regarding cannabis, but also drug policy as a whole. Okay, this I will skip because that's already been told by Steve very nicely. But yeah, I wanted to start by telling you a little bit about the history of Czech drug policy, because from the Velvet Revolution, which well, let's say, overthrown the socialist regime that was there. We've been fighting on and off against prohibition as we could. As early as 2001, we already decriminalized possession for personal use, but it didn't stop there. I think one of the big steps towards rational addiction policy in Czech Republic was that we integrated the policy, that we started regarding all addictions the same, even alcohol addiction, even illegal drug addictions, even behavioral addictions. So we have one integrated policy that takes into account all different kinds of addictions and deals with them accordingly. Moreover, we try to shift the focus, even in our national strategic documents, from the punitive model to the preventative harm reduction models. So even our national drug strategy is no more called anti-drug strategy. It is called the strategy to minimize harm and prevent the risky addiction. I need to here tell something about the people that came before me, because it's not like I did some miracle. There were the giants on which shoulders I stand on. One of them was Tomáš Zábranský, who is no longer with us, unfortunately. But this impact analysis project on new drug legislation was drafted in 2001, and you can still access it at, I think, TNI website. But for the time when it was drafted and published, it was revolutionary, and unfortunately, to this day, some of the parts of the project are still revolutionary, because we didn't make as much progress as we wanted to, needed to, and yeah, should have. Okay, so I was telling you about the national strategy. Here you can see it. The important bit is that we wanted to, maybe I can, okay, yeah. Is it working? Yeah, it is. We have this integrated strategy that talks about all the addictions, and we clearly state that we need to have effective regulation of the markets which provide addictive products, be it legal or illegal, so that we can minimize the harms more effectively. So this strategy was working from, or is still working from 2019, but we are still taking into account this strategy because there are 2 more years. Should I take it back? I'm sorry. Moreover, when it comes to cannabis, we've done some groundwork before we started to draft the changes that we more or less passed. We did regulatory impact analysis, which is unfortunately in Czech, but we took some parts of it and made this article in the International Journal of Drug Policy. We did a multi-criterion analysis of the different models that exist now and that provide us data. And we tried to assess which of the models is working best and which provides the best results regarding public health, regarding security, regarding budgeting and stuff. So this is what we started with. But the important thing to make it happen was that my former party, the Pirate Party, became a part of government 4 years ago. And that meant that I was allowed to insert this very important sentence. It is just one sentence, but it carried us through the term because I drafted it so that it contained everything we needed to argument for our case. In the case of financing for addiction services, but also in the case of regulation. The important part that we needed there was that the substances will be regulated in accordance with their level of harm. This is the important part, and this is the part that we relied heavily on in the coming years. What also, it's not good to say that, but what also helped us was the proliferation of new psychoactive substances on the Czech market, because they were flooding the market. They were being marketed as collectibles. They were not being marketed as products for human consumption, even though everyone knew they were for human consumption. So these were providing us with the activization moment that we could focus on and tell the politicians, okay, we need to do something about it. And yeah, I will tell you what happened then. Apart from that, of course, the trends in other European countries were very important for us, especially trends in Germany, because Czech Republic is notorious for wanting to follow the German example. So when Germany announced that they were going to regulate cannabis, our politicians instantly became more aware of the issue and more willing to listen to us on this topic. But also to not talk only about cannabis and to not talk only about, let's say, adult use. I don't like the word recreational use. We were also a part of the global research and experiment with psychedelic drugs and their use in psychotherapy. Our National Institute of Mental Health was or is a part of the MAPS studies with MDMA and also with psilocybin and ketamine. And so even though in evidence-based politics it shouldn't be a factor where these results were made, for the politicians, a lot of the times, the experiments that are done in their country feel closer to home for them, even though scientifically it doesn't matter at all. So, when we discovered this window of opportunity, we took to work, and I will try to make it brief and try to not confuse you, but it was a lot of things that we started doing, and they were running in parallel, which was very confusing for us, so I will try to not confuse you. So one of the efforts was we tried to decriminalize more. Even though we decriminalized self-possession in the early 2000s, there are still higher sentences for drug offenses that, for example, the European Union mandates us to have. Also, we still have this relic from the past, which is in the Czech Penal Code called spread of toxicomania, which is basically this paragraph that isn't defined really, and the police uses it how they want to. Sometimes it's used to persecute the sale of drugs in prisons. Sometimes they persecute a guy who publishes a magazine about cannabis. Sometimes they persecute the stores that sell growing equipment. So it's really like this very clumsy paragraph that can be used to prosecute people that the police doesn't want to be on the market or in the public sphere. Other than that, we wanted to regulate novel addictive services. I know they are not novel in some countries, but we still don't have the legal scheme for drug consumption rooms and also for drug checking. There are pilot studies running in Czech Republic, but this is not a legal service that can be funded through the grants from the Office of the Government. Also, we wanted to decriminalize the assisted psychedelic experience for harm reduction in psychedelic use. Not all of these came to happen, which I will talk about a little later. Regarding cannabis, we wanted to follow the full model. We wanted to have self-growing, we wanted to have clubs for people that can't grow themselves, and we wanted to have regulated market. And there was the issue of the novel psychoactive substances that were flooding the market, and for those, we wanted to try to figure out a new regulation scheme. I will come to that later also. And these three big blocks were formalized when working groups were established. There were politicians in there were experts, civil servants, there were representatives of different ministries and such. And we worked on the proposals for, let's say, 2 years. I will talk a little bit about the novel psychoactive substances that were beginning to be present on the market in Czech Republic, because it is important for the story of psychomodulatory substances. So we started seeing a lot of kratom. I don't know if it's present here in Norway, but it is a plant from Southeast Asia, and it is used mainly for a stimulating effect, but in larger doses it can have sedating effects, and it is very effective to cure pain, mainly because it interacts with some of the opioid receptors. Apart from kratom, we've seen a lot of new synthetic cannabinoids. We started with HHC, but that got banned. Then we had THCP, but also we seen a lot of experimental stuff like muscimol gummy bears, which is Amanita muscaria. It's a poisonous / psychedelic mushroom, and these were sold just as collectible items in grocery stores. So there was no regulation on how they were sold, how they were made, what's inside them, how much is in there, who is it being sold to. And we wanted to put an end to that. But we also didn't want for all these substances to get banned. And we really wanted to savor the opportunity that kratom wasn't and still isn't internationally controlled. So we had the space to try to come up with some other form of regulation. As you can see, the story with synthetic cannabinoids, I think it was more or less the same in every country. You ban one and 3 others flood the market the next week or in 2 weeks. So this is what was happening in Czechia. And fortunately, it worked in our favor because this was in real time showing the politicians that the bans don't work. They just don't. They banned HHC. The next week, there were 3 others in the stores on the table. And so we said, okay, we see that banning doesn't work. What we can do is we still want to protect the youth. We don't want these substances to be sold to them. But we want the adults to have access to safe products. And so we thought of this, it looks complicated, but it's really not, a system in which what is important is we see some substances in the gray zone, which is what I call when they are being sold as collectibles. We list them, which means they can't be sold anymore, but users who possess them are not criminalized. This is a difference apart from the banning of the substances. Then we do testing. If there are substances which seem like they could be safe for adults to use, or that have harms that can be minimized and that adults can use to some extent, we do more testing. And after the testing, we see if we want really to ban them according to their risks, or if we want to allow regulated access to these substances to adults. If you want to know more about this scheme, the psychomodulatory bill, you can read our report also in the International Journal of Drug Policy. But the road to get there in either of these 3 topics wasn't rosy, wasn't really easy. On the cannabis street, we were met with irrational negotiations, which resulted in for me, not a satisfactory result. Also, there were setbacks influenced by Germany, not wanting to go further with their regulation. And also, we had part of the government coalition were Christian Democrats, which really were not going strongly for the regulated market. So these were things that really cut us back in the cannabis. In the decriminalization efforts, which were lowering the sentences, providing better harm reduction, we had, unfortunately, we had pushback from the civil servants who wanted to protect the status quo. We had pushback from judges, from public prosecutors. Also, the director of the police, of the part of the police that is concerned with drug policy or combating drugs, he was going through the parliament and lobbying against the decriminalization efforts. And so it wasn't easy for us to make this thing happen, and that meant that we didn't really achieve what I wanted to. I was very ambitious, I must confess. So in summary, what we did was first the psychomodulatory substance bill, which regulate the access to some less harmful substances to adults. They can be sold in licensed shops. There can't be any children going into those shops. The product is regulated. It needs to suffice the regulation for human consumption, so there can't be no heavy metals, no microbiological contamination and such. But also there need to be some harm reduction. On the packaging, you need to have information about safe dosing. You have to have information about the amount of active substance in the product, so that we ensure the youth is safe and does not have easy contact with these substances, but also that the adults that decide to take it are informed enough to use it safely. Also, apart from these measures, advertising on these substances is strictly prohibited, so it can't be advertised at all. Regarding cannabis, we managed to do only self-growing and limited self-possession. And in the decriminalization, I think that was the least effective of our efforts. We had some lowering of the sentences. We had privileged offenses for cannabis, so there are lower sentences for cannabis, which I don't know if it's good or bad. That's complex for me. But one of the, I feel like, good things that came out of these efforts was that we now have legalized medical psilocybin. And from January, this can be provided to people with treatment-resistant depression. Okay, I want to quickly address some of the barriers, but also some of the facilitating factors regarding our efforts. Okay, so all of you know that the biggest barrier that we all face is the UN treaties. They effectively limit us in having rational drug policies, because they don't allow us to regulate the markets freely and to have safe product available to adults. Also, we had to fight with the prohibitionist narrative on the national level. It's not only the international level that pushes this narrative, we have to face it at home also. For member states of the European Union, it's a little bit harder still, because some parts of the UN conventions are part of the European Union law. So we face potential sentences, potential drawbacks regarding funding. So the member states are more motivated to oblige by UN conventions than, for example, Canada or US. Which was a step back, but I think we couldn't have done so much if we didn't do it this way. We did a lot of things at once, which meant that we were really working overdrive for 3 years, but it meant that the civil servants and the politicians and the institutions were infused with the argumentation, because we were still discussing the same issue, because the arguments for these 3 parallel activities were the same. So they became desensitized, and they became really understanding to our arguments over the course of the 3 years. And so what were the facilitating factors? We turned over their protect the youth against them. We said, yes, we want to protect the youth, but banning the substances won't protect them. We will protect them by regulating. And in this way, we also protect the adults. We protect them from taking unsafe product. We protect them from taking something they don't know anything about. And also, we pushed the line of the fiscal consequences. That was partly because we had a right-wing conservative government. But this was one of the arguments that pushed us forward with the psychomodulatory regulation. And of course, I need to say big thanks to some of the members of the parliament that really took it upon themselves to carry the regulation through. It wasn't easy for them, but once we established that we are doing this for the children, and this is the effective thing to do for the children and for the safety of the adult users, I was surprised at how even the most conservative politicians in Czechia really parroted our words and our phrases. And were saying to the media that bans don't work. It was like a fever dream. I didn't believe it myself when I saw it, but it really worked. So it was the addressing the emotions, but calming their fears with real solutions, not some prohibitionist dream that never really worked. Okay, thank you. Thank you very much.